Second tip I'm going to give you guys for imposter syndrome is making sure you guys are seeking support. It can be very, very challenging, especially as a new grad, when you are in nursing to feel that you're alone and feeling like you don't know what you're doing. Seeking the right support is very, very important, whether it's another nursing student. I mean, even another nursing student that you went to school with that's working and is going through exactly what you're going through, right? So they're going to be feeling that imposter syndrome as well. So it's even talking to them, seeing how they're doing, how they're coping, what are they doing to kind of help themselves and bettering themselves, learning during their shifts. So seeking that support from a fellow nursing student, seeking the support from your colleagues, other nurses on your unit is actually a really, really, really good source. Especially if they've been the nurse for 2+ years, 5+ years, 20+ years, right? You're going to gain so much experience and knowledge from these nurses. Ask them what they went through. How was it for them when they first came a new grad and were dealing with the imposter syndrome? And how did they get over it? What worked for them? Definitely seeking their advice, seeing what they tell you. They're going to know anything better than anyone out there. And again, because we've all been there. So getting that support from other nurses, so nursing students that you went to school with, having a mentor, maybe a nursing mentor. I do a lot of mentoring for some nursing students. I love it because I wish I had it whenever I was in nursing school in general. It's a good thing to have someone to talk to, just someone to listen. You know, you can talk about a shift you went through that was maybe one of your worst shifts as a brand new nurse, new grad, right? You're just learning, you're just trying to get the ropes and you're inexperienced. So you're just trying to get the flow of how things are going to be. Having a mentor can be any sort of nursing mentor, anyone that you can have that can just be someone to talk to, that can listen to what you're going through. And in particular, probably maybe another nurse, because they would obviously be very understanding of exactly what you're going through. You can always have a family member. You can always have a friend. Anyone that's really close to you that you can confide in, that you can talk to is always great too. Yeah, they may not be a nurse. They may not know exactly what you're talking about, but I feel like having that support from someone that can at least listen and be just someone that can listen, that you can just tell everything to, is super helpful. So having that support is so important. So I highly recommend finding a fellow nurse that's been there, done that, having a mentor, nursing mentor. You guys can always DM me. You can write me. You can email me. You can do whatever. You guys know where you guys can reach me. You can always let me know if you need anything. I would be more than happy to be supportive. Friends, family, other colleagues, other nurses on the unit, family, friends, counsel, anything. Support is super important, especially when you're feeling like you're going through this. And like I said in the very first thing, it's normal. Okay. So get that support that you need. See how people have gone through it when they were a new grad. Hey everyone, if you enjoyed watching that clip and you want to see the full video to it, make sure you guys click the box here. If you enjoy watching these kind of videos and you want to see more videos from the Nurse Kristen YouTube for pre-nursing, nursing student, new grad nurses, make sure you guys hit the subscribe button over here.